Health is your most important asset, and you want quality of care, especially high quality of care and access to care. Here at Family Care Center-Freeman Creek, they are innovative and coming across on a new model. And so I have Dr. Jody Prather here to talk to us about what's actually transpiring in our healthcare system. And we have something called a patient-centered medical home. Tell us a little bit about what's happening here at Freeman Creek.
Well, the patient-centered medical home, Karen, it's not a new concept. They actually had been talking about medical homes really since the 60s and 70s, when pediatricians started talking about that there was a better way to do comprehensive care for children. But it never really gained steam, but it's always been out there. And then in the last several years, I think it's had a resurgence, especially in primary care among family doctors and internists and pediatricians, because I think people realize that there's a better way to do healthcare. That the old model where a patient comes in and sees a doctor for 5 to 10 minutes and the expectation is all the care that patient needs will be provided in that setting, patients weren't happy with that, physicians weren't happy with that, and it wasn't the best care possible. So several organizations, the American Academy of Pediatrics and the American College of Physicians, the American Academy of Family Physicians, the leading groups in the industry, revitalized this idea of a patient-centered medical home where the goal is the patient and the physician, but also the folks around the physician, like medical assistants and nurses and educators, take a more important role, more aggressive role in the care of the patient. And so they came up with a formalized model called the patient-centered medical home. And Karen, when I say that to a lot of people, I think people hear home and they start to think of nursing homes or something along those lines. But it's absolutely based out of the primary care office. It's a better way to do primary care that focuses on several things for the patient. Most notably, care coordination for the patient, to make sure that across all aspects of their care, from specialist care to whether they need physical therapy to hospital care to the doctor's office, that folks and caretakers are acting in concert and looking out for the patient. There's also a focus on access. Everyone hears the complaint that I can't get in when I need to, and while we're not perfect at that, the medical home strives to make sure the patients have access to primary care instead of ending up in a much worse situation in the emergency room. We also focus on quality and quality improvement, and that's one thing that while there's frustration, and patients see that with physicians working on their computers instead of in the old charts, it does allow us to look at quality numbers and to track those things and be able to go to a patient and say, look, we look back and you haven't had all the health maintenance that the experts recommend, and track that, and then we can proactively help them manage that.
We hear the word outcomes, and you said quality. So we're looking at not only the outcomes of the care that's really centered around that patient, we want to make sure that they're getting to the best that they can be. Is that correct?
That's absolutely right. And so it's not only the medical home, in a way, will mean different things to different people. So in other words, the relatively well patient will come in, and the medical home will hopefully serve to help educate, to keep them out of trouble, so to speak, to keep them from becoming the sick person, to make sure they're getting all their preventive care, to make sure our women who are appropriate are getting mammograms and pap smears and colonoscopies and all the screenings, but also to educate those that are at some degree of risk. It really, I think, has an opportunity to serve also the folks who already have multiple problems and to maximize their health, especially because we're going to work hard on care coordination with folks that already have multiple diseases. Say they have heart problems, say they have diabetes. We think we have a real opportunity in involving a care team, a care coordinator, an educator, an MA, to be involved with that patient, where the physician can come in and focus on the key aspects of care, but everyone else is jumping in and saying, okay, let's make sure you have your medicine. Okay, let's make sure that you have your specialist appointment set and that we know that. We'll make sure we don't repeat the same tests that your cardiologist repeated, those kind of things. So, we talk about, and I think it's important to say, the medical home really came out of the concept of the triple aim in healthcare, where we realized that in this country something had to change for healthcare because of decreased satisfaction and increasing cost. And so the medical home is really aimed at improving patient health, improving the patient experience, and lowering the cost to both the patient and the system. And it's been shown to do that, and we think we're going to be able to do that here.
So we're really looking at the whole comprehensive picture of the patient. So they might be coming in, say, with the hypertension, what I heard you say, I think, a little earlier, but also making sure that they're having their preventative care too. So not just in and out on hypertension, we're making sure that they've had their mammogram, maybe making sure that they've had their colonoscopy, making sure that if they've got other disease processes, that they're totally taken care of.
That's exactly right. And we're going to track our quality on that and make sure that we're doing the right things as a practice. And if we see we have areas of improvement where we can serve our patients better, the IT systems and the which is information technology, which is the electronic medical record, is going to allow us to do that. So that's on a big picture. For each patient, there's going to be things happening behind the scenes in a medical home that doesn't happen elsewhere. In other words, every morning we're going to go through the patients as a team, both with care coordinators, nurse navigators, the nurse practitioners, the physicians, and look and say, oh, well, Karen's coming in today, and I know Karen's been having such and so problem and her diabetes has not been well controlled. What can we do? And we're going to then set a comprehensive plan. That's going to happen behind the scenes. What the patient will see is not only that interaction with the provider and the rest of the care team, but they're actually going to even receive care plans based on a collaborative effort where we get together and say, this is what needs to happen to improve Karen's health, whether it be through diabetes or hypertension or emphysema, and then go over with them how we're going to institute that. But part of the deal too, and this is important for folks to understand, is being a good patient in a medical home is going to be interactive. You know, there's going to be a lot of patient engagement, and so we're going to do a big part of it, but the patient, to really maximize their wellness and their potential, will have to be involved as well. And that's the reason as we go over these care plans, the patients will have things to do, but we think it'll be much more satisfactory to them, because before, very often they leave wondering, well, what can I do? Because it would be very much a doctor come in, boom, 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 and leave. Here we're going to try to be much more focused on saying, okay, here's the things you need to do from a medicine standpoint, but here's the things you need to do for yourself, and here's the resources and help to get them to be able to do that.
So collaborative approach, partnership is what I'm hearing you say, and then also responsibility on the patient's part to follow through with the goals and really team up with the healthcare group that's working with them.
That's exactly right. We think it's an opportunity to give our patients more education and more resources, but then at some degree it's kind of like we have to hand off the baton and they have to run at least a little way with it. But it's definitely a team-based approach, and that's one thing I stress. The difference will be, you know, as a physician, I may not spend a ton more time with the patient because we have the constraints and lots of folks who need to be seen. But the difference may be they get a couple other interactions with folks who come in and go over diabetes education with them, or go over education about their medication, or run their medication list, make sure they understand it. There will be more engagement with the patient, both by me and other folks in the team. And, you know, I think we hope it develops into a real, not only team-based atmosphere, but in a way a family atmosphere, that the patient feels like they have certainly that home that is supportive for them in all aspects of their health care.
So this is actually currently going on right now. The changes that the patient may see when they come for their visit, just more of a team approach? I
think so. They may even see there's more, could be a little more interaction with them having to give us some more data that we can use to help them. Certainly they'll be talking to some other people in the care team that may be asking them questions, but then using that to help improve their care. So I think hopefully they'll see some increased access. They may see a little hassle on the front end of having to answer more questions. We also thrive in a medical home from feedback. And we, you know, very often patients are used to doing surveys and not seeing results come from that. We are going to be asking our patients a lot, is this meaningful for you? Is this helpful? And the reason we do that is because if not, we want to be able to adjust that we want to give them the service that they need. So they'll see much more of almost a dialogue in a way, I think, not only about their health care, but also about their experience. But I think it's going to be much more opportunity. They'll be talking to more than just the MA, getting the vitals, getting me in the door as soon as they can, and me getting out. There's going to be much more of a dialogue and an interaction than that as well. So this is happening now.
This is also part of a national trend that's going on. So we actually may be seeing more patient-centered medical homes in the near future too.
Yeah, it's been a national trend. There's been a great number of medical homes across the country that have come into existence. They're national crediting organizations. It's worth mentioning that we're being accredited by the one that is most noted, the National Commission on Quality Assurance, NCQA, and they make sure that we're doing all these things right. We think we're doing them right. We think we're making steps in the right direction, but because they're a certifying body with their expertise, they come by and verify. So we're going to hopefully have that certification very soon. We're putting all the processes in place. And nationally, there are a goodly number of NCQA medical homes. Interestingly, in the region, here in the heartland, here in north central Kentucky, you don't have as many, and so we're a little bit pioneering. There are a few, but we're a little bit pioneering. One thing we're doing is the NCQA, which certifies, has a certain level of checklists you have to meet to be a certified medical home. But here at Freeman Creek, with the support of Hardin Memorial Health, we think we're taking that to the next level. For instance, we've have a nurse navigator, which is not a requirement, but I think is key. That is someone who is going to really help us coordinate this, look after the patients, develop a relationship with the patients, follow them, and make sure that we're doing all these things. And so I think we're doing a medical home plus in a way. So we're doing the basic things that it takes to get certification, but we're trying to make sure that it really is an added value to the patient to be coming to a medical home.
We're really charting the way here at Freeman Creek for just collaborating with patient care, making sure that there's comprehensive care and high quality care. Anything else you'd like to add, Dr. Prather?
Well, nothing other than it's an exciting time. I think in my practice and our practices, the providers here, we've always focused on the patient in large part, and we always thought we were doing things exactly right. And while I think we provide pretty good care, this exercise has allowed us to see that we do have places we can improve, and places that engaging the patient and working with the patient and bringing them in and bringing other team members in really is going to enhance not only the patient experience, but patient health in the long term. So in other words, we've been practicing pretty good medicine, I think, overall, but this is really going to take us to the next level, and I think prepare us for the future of healthcare and prepare our patients for the future more so. So I think that we're starting this here, but I think folks will see it take hold more and more, and hopefully we'll be giving folks something very positive both for today and for the future.
We appreciate your time today, Dr. Prather, and for more information about any of Hardin Memorial Health services, we invite you to go to the website at www.hmh.net.